Why is the medical profession so obsessed with blood pressure? Especially since 90% of the time, we can't define what caused your blood pressure to be high. When I was in medical school, blood pressure elevation was considered 140 over 90 or greater. And it was redefined in 2017, and now hypertension is considered any blood pressure greater than 130 over 80. They were diagnosing people with prehypertension. They eliminated that. But that change increased the diagnosis of hypertension by 14% 7 years ago. Hi, if you're new to my channel, my name is Brian, and I practiced in the medical profession for 30 years and walked away in 2017 over issues like changing definitions, narratives, and algorithms. So now I'm a health coach, and my goal is to keep you out of the doctor's office. I have a personal interest in this issue in the fact that I was diagnosed with high blood pressure at age 30 right after I finished my OBGYN residency. I hadn't seen a doctor the whole time, so I went to a friend of mine who told me, if we don't get your blood pressure down, you're going to the hospital. And I told her, I said, I don't have time to go to the hospital. I have to do a surgery in about 2 hours. So we got it down, but then I've been fighting that now for 34 years. I'm 64 years of age, and I've taken all the different types of blood pressure medications and experienced all the side effects. The information I'm sharing with you is from an article written in July of 2024 by an anonymous physician known as a Midwestern doctor on Substack. This physician apparently is still practicing, so is not going to do videos because they would be taken down. And if I shared all the details on this platform, the video would be taken down as well. So the deep dive and all the crucial information and data I'll be doing on the Health Without Risk app starting this weekend. There are 4 classes of blood pressure medications. Today we're going to look at the beta blockers. We've looked at the diuretics and the calcium channel blockers. I still take a beta blocker, and I made the mistake the other day before my physiology class and took my medication without monitoring my blood pressure, and I over-medicated myself and almost passed out while I was teaching my class. Beta blockers are frequently used for management of high blood pressure. They slow the heart rate and they decrease the force of contraction of the heart muscle. So they're also used for congestive heart failure. The problem is they have lots of side effects, and I've experienced most of them. So when I took my blood pressure and tried to teach, I was fatigued. I was slurring my words. I couldn't keep track of the information I was trying to convey to the students. You also can get sexual dysfunction, insomnia, and there's changes in moods. I can't say that I've gotten depression or depressed affect from my labetalol prescription, but I can certainly tell you that you can over-medicate with a beta blocker. I monitor my blood pressure with a digital blood pressure cuff, and if my blood pressure is not elevated, I don't take my beta blocker. But if I make a mistake and don't check and take my medication, I can get in trouble. 3 years ago, I was having dinner with some friends of mine at a restaurant, and I had taken my beta blocker without monitoring my blood pressure and got side effects, and actually passed out at the table, threw up on the table. They were going to call the ambulance. I knew what had happened, so I managed to avoid going to the hospital. But I haven't been back to that restaurant. I'm sure they remember that. And of course, I get text reminders from the pharmacy saying it's time to refill your labetalol. Well, I may not need some, but the insinuation is you should take this medication twice a day, every day, whether or not your blood pressure is elevated. And that's a problem. The take-home message from this part 3 on blood pressure medications is to monitor your own blood pressure. especially if you're on a beta blocker or any blood pressure medications. Take your blood pressure before you take your dose so you don't do stupid things like pass out in restaurants like I did. If you need a good blood pressure cuff, email me and I'll show you the ones that I recommend. And if you want the full details of this article and an alternative way of looking at blood pressure and blood pressure management, join the Health Without Risk app. I'm starting this series this weekend, and I won't put it anyplace else. It'll just get taken down. Have a great rest of your day, and I'll talk to you tomorrow. See ya. Bye.